what we are presenting here. So, like lots of studies, epidemiological studies have done starting from 2001, 2010, 2012, looking for how many percentage or how many people who are diabetic would actually fast. Would it be like 10% in like whole Ramadan? Would they fast whole Ramadan, 15 days, 10 days? So what do you think? That would you say that less than 50% of Muslims who suffer from type 2 diabetes would fast for at least 15 days? What does it say?
I think it's true.
True?
Mm-hmm.
Actually, it's false. Many people will attempt. Many people, more than, look at the data. So we have these three main studies, which are the key things. The CREAT study, the EPIDAR study, they actually saw that the type 2 diabetic will at least fast. 80% will fast more than 15 days. CREAT study, 94% will fast study. And a Darmina study, which is the latest one, 2021, which was 86% of people suffering from type 2 diabetes would at least fast more than 15 days. So what does it tell us? It tells us that regardless of would you educate patient or not, they would at least attempt, right? The question is, when they suffer these grave consequences, they don't know what to do, or they don't have a good response. So the future events will become very hard for them, right? And a lot of anxiety, shame, and guilt start to present. So that was the need of the evidence-based guideline came into it, and that was the basis. So what happened back in 2013, the chair of MENA, Dr. Mohammed Hasnan, after the 2030 meeting, he called up IDF and said that there is a grave need, and we have to make up our own alliance by the name of DAR, so Diabetes and Ramadan, and he chaired that. And he and his team came up its first own guideline in 2016. And this gentleman, may Allah bless him, he is a very active, more than 500 peer-reviewed journal articles under his belt. He is a practicing endocrinologist in Dubai, UK trained. He co-authored way ahead American Diabetic Association, most of the 3-4 statements. He's the first author and chair of DAR Alliance still. And with the Canadian position statement, he is the international topic expert that we went and seek his help for. And currently, he came up with the second guideline 2021. So DAR has now 2 guidelines. The first one published 2016 and 2021. So the blue one, that is a practical guideline that we would, so it has this guideline has 15 chapters. So the first, they talk about introduction, epidemiology, prevalence, then pathophysiology, and then they talk about each and every scenario in type 1, type 2, oral glycemics, insulin, and risk stratification, nutritional plan. And Shasta will go over how they have made this very good web-based interactive nutrition plan. And they do talk about complications as well.